Hello and welcome to Tiny Tales. Today's topic is extremely important for everybody on the planet. Also, as long as you have a uterus. It means I am going to be talking about endometriosis. Now, endometriosis is a disease or a condition which can affect anybody who has a uterus, fallopian tubes, and ovaries. Now, what is endometriosis? Endometriosis is a disease which stems when the lining of this uterus goes and deposits outside the uterus on the tubes, on the ovaries, in the pelvic cavity. I had run like a small question answer forum where a lot of people asked me this question as to who can get this disease. Now, like I said before, anybody and everybody with a uterus can get this disease. How does it happen? It happens because of hormonal changes which happens due to your menstrual cycle, and the same hormones which affect your menstrual cycle also affects the formation of this lining in and outside your uterus. Now, during your periods, when your hormones fluctuate and when they make up this lining grows, settles, thickens and breaks down and causes a period. Same way, these hormones affect the lining which is depositing outside in the pelvic cavity, and because of these hormones, the same settling down of these lesions or these implants will grow, will settle and thicken and break down, and that causes a lot of pain, causing the endometriosis, pelvic pain. What are the symptoms? A lot of people have asked me this question, like, what are the symptoms of endometriosis? The most common symptom is pelvic pain. Now, when you are on your periods and your periods are absolutely unbearable, you have a lot of lower belly, pelvic pain, lower back pain, please go to your gynae to get a checkup as to why you're having this pain. It can be due to endometriosis. Heavy cramps, heavy menstrual bleeding in between the periods or during your periods, and another major symptom is infertility or the inability to conceive. Another main symptom is pain during sexual intercourse, discomfort during bowel movement. Do you have constipation? Do you find it difficult for urination to happen? Lower back pain. What is the treatment? Though there is no cure and treatment for endometriosis, there is always a chance that you can decrease the symptoms and live a pain-free life. There are some women who may get pregnant before endometriosis. Now that is up to them if they want to get pregnant, because a lot of doctors say that endometriosis symptoms can be decreased if you get pregnant, but that is not the case every time. Not every person with endometriosis or a woman who wants children with endometriosis can get pregnant. In such a case, you need to see your IVF specialist. Now, a lot of people have asked me, how can the symptoms be managed? The symptoms can be managed medically. Over-the-counter drugs, OTCs are available, but please don't take them without the prescription of your doctor. Another way is the surgical method. Laparoscopy is definitely recommended. It's the gold standard to diagnose your endometriosis. Laparoscopy is one of the best methods to view and diagnose this disease. There are hormone therapies, there are hormonal contraceptives, and please take them only under your doctor's guidance. Please do not take this video. I will add a disclaimer as I'm saying this. Please do not take this video as any medical advice. Conservative surgery. Now, laparoscopy, like I said, is a conservative surgery where your doctor will go into your pelvic region, find out what is wrong, why the pain is coming. She will try to excise the lesions. She will try to excise the ovarian tissue which is forming on the pelvic, in the pelvic region, and try to rid you of the endometrial lesions and implants, thereby completely reducing your pain, and she may even put you on hormonal therapy after that in case you are not looking into starting a family. Another final last resort treatment is total hysterectomy, TH, women who are not interested in having a family, or women who have already completed their families can go in for a total hysterectomy, where your gynae will completely remove your uterus, your ovaries, and fallopian tubes. Basically, the entire reproductive system goes out of the window, because all of them are definitely affected, and you can be completely pain-free after your TH, especially only if your gynae has completely cleaned and cleared out every single lesion in your pelvic cavity. What causes this endometriosis? Like I said before, it can be retrograde menstruation. Retrograde menstruation is nothing but the backflow of the blood from the uterus through your fallopian tubes and into your pelvic cavity. So as and when hormonal changes occur every menstrual cycle, these hormones are also going to play on the lining in the pelvic cavity, thereby breaking it down, building, settling, etc. So thereby causing it pain. And these implants, of this blood which flows out and sticks there, acts like the endometrium inside the uterus. But the only difference is, once it grows and thickens and sheds, it does not have any place to exit. Thereby, it starts clotting and giving you pain and giving you scar tissue and becoming adhesive to all other organs nearby. Another theory is the endometrial cells travel through your lymphatic system and out of the uterus. So once the endometrial cells starts traveling through the lymphatic system and it exits your uterus, there is a high chance that they may go sit anywhere in your pelvic region, and sometimes in very rare cases, these endometrial cells or the endometrium may even go and deposit near your lungs in rare cases, and that may be life-threatening, obviously. Another theory is a faulty immune system or an autoimmune condition that is not destroying these errant endometrial cells. Now, our immune system sometimes starts misbehaving rather, and it starts attacking our own cells. Now, when these endometrial cells are released, the immune system does not recognize it as our own, and it starts generating an inflammatory response against these cells, thereby causing endometriosis. Another theory is genetic. Endometriosis is definitely genetic. If you have somebody, if your mother or grandmother or any woman in your family has been suffering from endometriosis, or check for their total hysterectomy history, you will know they may have been fighting endometriosis. Another factor is environmental toxins. If you have a lot of environmental toxins like probably cigarette smoke, alcohol, if you live in a construction site, if you're inhaling a lot of smoke every day, pollution, all these toxins, it just may give you endometriosis. The stages are minimal, mild, moderate, and severe. You should go ahead and read further as to what these stages are. How do you diagnose this? Now, the symptoms of endometriosis are very similar to when you get ovarian cysts, ovarian torsion, painful periods, pelvic inflammatory disease. Treatment of your pain requires accurate diagnosis by your gynae. Now, how will she diagnose you? She or he will call you into their clinic and do a physical touch examination of your abdomen, and they may even try to maybe feel your cysts. The other method is USG, ultrasound guidance. It's of two types: abdominal scan, transvaginal scan. Transvaginal scan is through the vagina, and abdominal scan is just on the abdomen. But these scans are not very effective. Laparoscopy. Now, laparoscopy, like I've already said, is the gold standard for diagnosing and treatment. It's the only certain method to view directly minor to maximum major lesions, and it's a minimally invasive surgery. It's a very safe surgery. The recovery rate is very fast. You just need around a week or so to recover. Now, to move on to the risk factors. What are the risk factors and who is at risk? Anybody with a uterus between the ages 25 to 50 is at risk, and the symptoms will definitely start at puberty. Painful periods, etc. Family history. Like I've said, like I've already mentioned, please talk to your family members, your mothers, your grandmothers, your sisters, whoever's had painful periods and all of the symptoms I have mentioned in this video has gone in for a total hysterectomy. They may have been suffering with endometriosis. That definitely puts you at a risk. Pregnancy history. If you identify yourself as a woman, pregnancy may temporarily decrease the symptoms. I repeat, temporarily decrease the symptoms. I say this because before and after a child, you definitely have your uterus in place until and unless you decide to forego it and you don't want any more children. But as long as you have a uterus, there is always a chance that the hormones every menstrual cycle may again grow, settle, thicken and break down this lining, thereby giving you endometriosis. So until and unless you undergo a total hysterectomy, depending on the choices for your family, whether you want to have a family or not, until and unless you have a total hysterectomy, you are not going to get rid of endometriosis, which obviously means you have no respite till the time you menopause. Menopause is another condition. It's not a condition. Menopause is when all hormonal activities from your ovaries stop and all your periods stop. So obviously there is no hormonal influence on your uterus or your ovaries to be building, breaking, thickening, settling and breaking down this endometrial lining, and thereby you have a lot of respite from endometriosis. It's almost over after menopause. You can also find out whether you are at a risk for endometriosis by looking at your menstrual history. If you started your periods very young, say 12, 13, which also called early periods, if you've had shorter cycles, heavier, longer periods, when does it resolve? Does it ever resolve? Yes, menopause. Thank you for all these questions. I feel privileged and honored and my duty to be here talking about endometriosis, because a lot of us, a lot of people, a lot of families supporting patients with endometriosis, supporting people with endometriosis do not have a lot of knowledge, do not have a lot of idea as to what this is. So I would definitely leave you with 8 blogs, some of these superb, the most amazing blogs for 2021. I would also leave it in my description box below this video, and I would also take this opportunity to read out the names of these blogs which I got from the website of Healthline, and all my points have been lined up from that particular website. It's also my personal favorite go-to website for all my medical research. And yes, please don't shower your medical research, which is often called Google reading, in front of your doctors. You can always place this information from a point of curiosity in front of them instead of telling them what to do. Now, to tell you to read out the names of all these wonderful blogs on endometriosis, please get onto these blogs and read about endometriosis, find out your symptoms, find out if you really have endometriosis, if you have a very low quality of life because of this disease. There is always hope, there is always a choice. Moving on to the names. The first blog is Endometriosis Foundation of America. Second, endometriosis.org. Bloomin' Uterus by this wonderful woman called Lisa, who was diagnosed with endometriosis in 2014. It is her story and she will tell you all. It's an all reveal. Dr. Sekin's endometriosis blog. It's Sekin's, it's Sekin. So it's Dr. Sekin's endometriosis blog. Anyway, you have all the information in my description box. Endometriosis Association of Ireland's blog. Endo Black. There's a beautiful blog for all the black community, all the people in the black community. It's called Endo Black. Please do check it out. And then there's a blog called Quendo. It's Quendo. And last but not the least, it's Endometriosis News. So I hope this video was very valuable it's helpful, please share it with all your friends, all your family members, or even if you don't want to share this video, please do talk about this very important health issue. And before I say goodbye, I also want to say that if we are women or men, we need regular checkups with our doctors. Please ensure that you go to your doctor and get 2 checkups a year. Full scans with blood work, all scans, transvaginal, abdominal, chest scan, x-ray, everything, whatever you need. Just go to your doctor. Just go out there and get your examinations regularly. I, for one, get even my teeth cleaned twice in a year. Anyway, that was a little quip. Before I finish this video, I hope you like this video. Please like, share and subscribe to my channel for more such informative and fun videos, of course. Thank you for watching and see you soon.